So we are moving on today to intuitive eating principle 2 and how that might affect eating disorder recovery. If you missed the first one, check the link in the description box below. We go into ditching diet culture in our last video. So today we're going to really talk more about the second principle, which is honoring your hunger. For most of the people who come to Calm Clinic and they want to work on intuitive eating, this is really what they think of as intuitive eating. You eat only when you're hungry, you stop when you're not hungry anymore, ideally when you're full. And what sounds more intuitive than that, just listening to your natural hunger and fullness cues? Well, as clinicians at the Calm Clinic, we often find a couple issues with the execution of that, and so I'm here to cover those today, figure out what's getting in the way of more authentic hunger and fullness cues and being able to truly honor your fullness, and then we'll come up with some solutions along the way. So let's get started. The first thing that's going to get in the way of being able to honor your hunger truly is that a lot of us ignore our hunger. Sometimes it's intentionally. If you're dealing with, if you're in the middle of a diet or struggling with some disordered eating behaviors, there are reasons we feel stomach grumbling and just don't answer it and try to push it off as long as we can, or try to wait it out essentially until we can eat at a later time. There are also ways that we sometimes unintentionally ignore our appetite. If you have a busy work day or if you're out getting a lot done, there may not just be the opportunity to be able to honor your hunger fully. So in those ways, oftentimes we find ourselves just ignoring our hunger signals, and over time that can actually throw off the energy regulation system in the body and make hunger signals less reliable over time. The second thing that sometimes will get in the way of honoring true hunger and fullness is that sometimes we numb out to our hunger cues. So it may not be that we are feeling it and ignoring it, but rather there are some times throughout the day-to-day or week-to-week where if this condition is presenting itself over and over, it's really going to suppress appetite signals. And those conditions typically are a really busy or heavy workload, high levels of productivity, focus, concentration, a lot of executive functioning in the brain, a lot of thinking, and being distracted by work, and then also sometimes things like anxiety, depression, sadness, really strong, intense emotional experiences. Those can all essentially disconnect us from our body and really suppress when the body is trying to tell us that it needs food or appetite. So we have to sometimes notice too that if we're going longer than 4 or 5 hours without food, we are actually experiencing probably suppressed appetite, because most of the time the body typically needs another meal in that 4, 5, maybe 6 hour mark. And then the third and final reason that oftentimes we maybe are not getting true or authentic hunger or fullness cues is a lot of us are actually afraid to feel full. So many times and in so many different ways, we're often taught that feeling full is actually a sign that we've eaten too much, or feeling full makes us feel like our stomach is too big. And so if we have those fears of fullness or feeling full and satisfied by a meal, we're often going to only eat just enough to not be hungry anymore. And that might lead to feeling hungry or thinking about food again, maybe 2 or 3 hours after a meal, sometimes even shorter. And that puts us in a loop of just generally never feeling satisfied in our appetite. So those are really the 3 main reasons that we see that people are not quite able to authentically follow their hunger and fullness cues and take full advantage of the intuitive eating process. So if a lot of us are ignoring our hunger or numbing out to our hunger or afraid to feel full, how is intuitive eating and honoring our hunger actually supposed to work? Well, if you find yourself in any of these situations, there are a couple of guidelines that we usually recommend to get yourself back on track and get back into a more regulated pattern of hunger and fullness. So the first thing that we would recommend is really noticing the gaps of time between the meals that you're eating and how satisfied you feel after those meals. Ideally, we want to have a full meal within an hour or 2 of waking up, and then generally every 4 to 5 hours after that. That follows your body's kind of natural rise and fall rhythms of blood glucose, the way that it is released into the blood and about the length of time it takes to reabsorb it, use it for energy before the body starts needing more. And typically at that time is when we would start to feel those hunger cues. So that's the first thing. If you're not really feeling like you're getting hunger and fullness cues that lead you to eating specific specific meals, you want to institute those specifically into your day. And if you're able to follow that, by the clock or by routine, ideally you'll start to feel that your hunger cues adapt to that. And typically what we find in the clinic is that generally takes 4 to 6 weeks, sometimes shorter for some people and sometimes longer for other people. The next thing that we want to do to reestablish healthy hunger and fullness cues is to really zoom in and pay more attention to what we think of as atypical hunger cues. And I kind of mentioned those a little bit earlier. There's a video in the description box below that talks more about it. But essentially, if you're not getting stomach grumbling and you're not really noticing it and you're starting this consistent meal pattern and you're still not really feeling it, I want you to kind of think about maybe some of the other ways your body is telling you that you need food. Are you yawning a lot? Are you finding that you are at a certain point of the day where you are trying to focus on your work and you really can't, and you find yourself kind of staring off into space? Do you find yourself preoccupied with snacking or food, or feelings that you want to get up and leave your workstation, or feelings that essentially you just can't kind of continue to engage with what's in front of you? That is usually a really good sign, especially if it lines up with, going more than 5 hours or so without eating, that you probably need some nutrition. So think about those types of moments as the ways that your body is trying to tell you and communicate to you that there's hunger happening in your body, even if you're not feeling that stomach grumbling. So get acquainted with the atypical hunger cues that your body is trying to use to get you back on a more nourishing eating pattern. The third piece to this, and getting back to regular hunger and fullness cues, is your fullness, and really trying to challenge some of the fears around that. Ideally, you should feel comfortably full and satisfied after a meal. You should feel like you've eaten something, and you should feel that if you were to eat any more, you'd start to get to the level of discomfort. If you find yourself eating enough that actually, if you think about it, you could eat more of that meal, have a second portion, even have 2 portions of that meal, it's usually an indication that you're underserving yourself and you want to get to that level of fullness. Particularly in the breakfast and lunch hours, that's usually when we're most active and need the most energy during the day. So that's the next thing to start practicing, is really reframing what fullness is in your mind. A good, solid, filled, satisfied feeling in your stomach in particular is telling the body that you have enough energy to last you for the next 4 to 5 hours without having to think about food anymore or worry about getting a snack or a next meal. Whereas if you're eating just enough to not be hungry anymore, that's typically something where afterwards you might find that you're hungry for a snack, or in a couple hours you're really already kind of preoccupied and thinking about your next meal. So that would be the next tip, is just make sure and start practicing that when you're eating a meal, you ideally are feeling full and satisfied afterwards. And then if you start to notice, this is the fourth thing to start doing to reorganize how your hunger and fullness is communicating with you and your body. If you start to notice that you feel overly full or uncomfortably full with what looks like, compared to what someone else might eat, a small portion. If you find that you serve yourself a plate of food and you really can only get maybe halfway through, or you're struggling to feel comfortable after eating a typical sized meal, that might mean that your digestive system has just slowed down or is in some other way compromised. Oftentimes that can happen with prolonged undereating. So essentially there are a couple things that potentially a dietitian or nutritionist or your doctor could help you with. There are potentially some over-the-counter aids to help with that feeling of fullness, to reduce it a little bit, and allow you to eat filling and satisfying meals without that feeling of discomfort. Generally, what I try to help my clients understand is that just because you're feeling full and uncomfortable, the amount of food that you're eating, if it doesn't look like what a typical meal might look like to someone else, it probably isn't enough. And so the fullness or discomfort doesn't necessarily mean that you've eaten too much. It means the digestive system is just so out of practice with remembering when these meals are coming that you're eating, and it's actually not prepared for it yet. Doesn't have the enzymes going, doesn't have the acids going, doesn't have the muscular function going to get everything through. And so it's going to take a little bit of time for the digestive system to get back online. And so like I said, if you're noticing that in the meantime, talking to a professional can really help with maybe some over-the-counter aids or other recommendations to help reduce the discomfort while you're working back towards regular sized meals again. So hopefully if you stick with these tips, ideally in the next few weeks, 4 to 6, maybe 8 weeks, ideally you're starting to feel that your hunger and fullness signals are more regulated, more reliable, and not leading you to go maybe many, many hours without noticing appetite, or potentially leading to not enough in the morning, having overly full or uncomfortable feelings at night. Essentially just evening out your hunger to a more predictable pattern throughout the day. So I hope these tips really help you out. Please let us know if you have any questions, thoughts, comments in the boxes below, and we will look forward to seeing you for principle number 3.